Hello, I'm Dr. James Kelly. I'm the Medical Science Liaison for L-Nutra.
And I'm Dr. Kurt Hong. I am the Executive Director for Center for Human Nutrition at USC.
And we're here today to talk about fasting. So let's talk a little bit about fasting mimicking diets and how you mimic fasting with food.
So traditionally, when we want to get the benefits of fasting, we really have to do a prolonged fasting, meaning that typically we're talking about water-based fasting for at least 3 to 5 days, if not longer. The problem with water-based fasting is for a lot of patients, number one, it's highly inconvenient. Number two is for patients with certain medical problems, it can actually pose certain risk. However, we do want to more and more patients to take advantage of the fasting state, and hence the fast mimicking diet was developed. So essentially what the fast mimicking diet hopes to do is while you're able to consume calories, your body thinks essentially you're in a fasting state. The type of food that's used in the fast mimicking diet are actually a plant-based regimen from about 200 different sources, and it's a combination of different micro and macronutrients that even though you're eating calories, your body thinks, again, it's in a fasting phase.
And this is real food? This is natural food?
This is actually natural food, and as I mentioned, this is plant-based food. This is completely gluten-free, it's completely dairy-free, and the beauty of this particular regimen is you do it for 5 days. This is a box of food that's delivered to you. It's clearly labeled. This is day 1, day 2 through day 5. It's a combination of different types of food, whether they're soups, bars, as well as various snacks. And essentially, during those 5 days, you basically would just consume this box of food. Once you're complete with the 5 days, for the next 25 days, you just need to maintain a healthy diet. A lot of people like the flexibility that they don't have to go on a strict regimen. You know, there's a couple of different intermittent fasting regimens that's also pretty popular out there now, where you have to fast either every other day or you cannot eat for at least 15 to 18 hours. And this, even though some of these other fasts, you can get some of the similar metabolic benefit, the fast mimicking diet is the only diet that actually truly mimics more of a prolonged fast.
And what happens during that? What are the clinical benefits of that?
So if you look at a lot of the preclinical as well as clinical studies that have been published over the past 10, 15 years, the first thing that happens is that your body actually goes into a ketotic state after you basically go on the fast for the first 12 to 15 hours. Once you get past that initial 24 to 48 hours, this is where you see a lot more profound benefit at the cellular level. Whether this is augmenting the cellular stress resistance, whether or not this is activating what we call the autophagy response. And what the autophagy response is really will optimize your cellular maintenance. You basically allow your cells and your tissue to operate better, more efficiently, if you will. And once you get past that initial 4 to 5 days, you get additional benefit where you actually see an uptick in terms of stem cells in the peripheral blood. This is an important part of basically the benefit of fasting because these are the stem cells that participate in tissue regeneration and rejuvenation.
Wow, great. So what happens to the body during this, like during day 1, 2, 3, 4, and 5? What can I look forward to experiencing?
So the first couple of days, it's a relatively easy diet to follow. It's anywhere between about 850 up to about 1,000 calories. By the time you get to day 2, there are some patients who may experience mild headaches or they may notice a little bit of fatigue. But once you're able to get through about day 4, by day 5, you actually feel a lot better. We actually have a lot of patients who actually will report back to us telling us they generally feel better, they have more energy, they have more mental clarity, and they love the fact, again, it's only a 5-day cycle. For those patients who then basically proceed to complete that cycle 2 and cycle 3, because they've already done the first cycle, they realize it's much easier the second and third cycle.
So each time you do it, the side effects get less severe and less common?
Absolutely.
Great. If you'd like to learn more about fasting mimicking diets, you can go to www.prolonfmd.com.